Bismillahirrahmanirrahim. So, in this lecture, we will cover the topical antibiotics that is usually used for management of the wound. We all know that whenever there is a damage to the skin and there is a damage to the skin integrity, then microorganism that is usually present over the skin could easily penetrate through that damaged area into our body, and these microorganisms can cause infection. So, according to the skin microbiota, bacteria, viruses, and fungi are usually present over the skin, and the respective microorganism penetrate into the skin according to the medium that is provided and according to the area of the body and according to the layers of the skin involved. So if the hair follicle gets clogged with sebum, and the person's skin is oily in nature, so the QT bacteria penetrate into the hair follicle, and these QT bacteria cause acne over that respective area. And the areas usually involved are face, axilla, submammary fold, trunk, and upper shoulders, where the acne lesions are usually formed. Okay, the if the area is moist in nature, where the sweat glands are present, like in our axillas and our groin, then cornybacteria penetrate into the sweat gland, and these cornybacteria cause erythrasma, which can becomes into the category of bacteria as well as fungi. And if the overall skin is dry, then all type of microorganisms are usually present over the skin, and these microorganisms penetrate according to the layer of the skin is involved. So basically basically if there is a damage to the skin, like in burn, pressure ulcers, diabetic foot ulcers, then there is a high chance of penetration of staphylococcus that cause inflammation, redness, tenderness, and warmth over their respective area. And if the patient body is not covered in an hygienic environment, then there is a risk of streptococcal bacterial infection that cause furunculosis, folliculitis, carbuncle, abscess, and cellulitis as well. And if the trunk and abdomen is moist, gets moist, like in summers, then there is a chance of malassezia infection, and demodex is parasitic in nature. And if the multiple layer of the skin is involved and the patient is immunocompromised, then there is a risk of proteobacteria that cause pseudomonas in infection over that respective area. So basically these are the microorganisms, and they get penetrate into the body according to the layer of the skin is involved, according to the part of the body is affected, and according to the medium that is provided to the organism. So basically, the usual microorganism that penetrate into our body earlier are Staphylococcus and Streptococcus. So basically, in this lecture, we will cover the bacteria that penetrate into the body, and antibiotic that is affected against those bacteria. Okay. Bacteria are further divided into two categories: gram-positive bacteria and gram-negative bacteria. So, Staphylococcus, Streptococcus, Micrococcus, and Corynebacteria, they come into the category of gram-positive bacteria. And in the category of gram-negative bacteria, Pseudomonas, which is caused by Proteobacteria, E. coli, and Actinobacteria, are gram-negative bacteria. So, with respective to topical antibiotics are divided according to the category of the gram positive and gram negative bacteria. So the usual common antibiotic that is usually prescribed in routine clinical practice over the diabetic foot ulcers, pressure ulcers, and over and if the damage to the epidermis and dermis is fusidic acid. Fusidic acid is principally active against staphylococcal infections. Basically, it is active against gram-positive bacteria. So whenever there is a burn, a superficial burn, there is a little bit ulceration over the skin, and there is damage to the epidermis and dermis, then fusidic acid is commonly prescribed in routine clinical practice because it is active against gram positive bacteria and active against staphylococcal infection. And staphylococcal is the common antibiotic that penetrates earlier as compared to other microorganisms of the body. So the second antibiotic that is active against bacteria are mupirocin. Mupirocin provides a wide range of coverage against both gram-positive and gram-negative bacteria. So, if the multiple layers of the skin is involved, or if there is a deep skin infection, then mupirocin is usually prescribed in routine clinical practice because it is active against all type of bacteria. The third antibiotic that is active against bacteria are polymyxin B, and polymyxin B is active against both gram positive and gram negative bacteria, and it comes in the market with the name of Polyfex. And Polyfex has two antibiotics, bacitracin and polymyxin B. Bacitracin is active against gram-positive bacteria, and polymyxin B is active against both gram-positive and gram-negative bacteria. So the Polyfex has two further antibiotics, and that provide a wide range of coverage in case of burn, in case of pressure ulcer, in case of ulcer decubitus, in case of road traffic accident wound as well. So, bacitracin, as I have already mentioned, is active against gram-positive bacteria, and it comes in the market with the name of bacitracin ointment. It also comes with polymyxin B with the name of Polyfex ointment. Okay, these are the topical antibiotics that is usually prescribed in routine clinical practice against superficial ulcers, against the burn, against the diabetic foot ulcers, and other damage whenever there is a damage to the skin. And then these are the antibiotics that is usually prescribed. So, and these are active against both gram positive and gram negative bacteria. Okay, so as I have already mentioned earlier, the like Propionibacterium acne, which is also labeled as Cutibacterium, which cause acne lesions over the face, axilla, trunk, and upper shoulder. And the bacteria that is active against Propionibacterium are erythromycin and clindamycin, and it comes in the market in the form of lotion, gels, ointment, and cream, and these are active against Propionibacterium acne, which is also known as Cutibacterium acne. Okay. Uh, the gram negative bacteria, which is proteobacteria, cause pseudomonas infections, and also pseudomonas aeruginosa infection that is seen as greenish coverage over the wound. And the pseudomonas usually infect the respective area of the skin if the patient is immunocompromised, and if the and if the all of the layers of the skin are involved. So pseudomonas in aeruginosa is caused by uh, uh, proteobacteria, gamma proteobacteria, and it is usually seen as greenish coverage over the damaged area. And it is the antibiotic that is active against Pseudomonas aeruginosa is gentamicin, and gentamicin comes in the market with as in the form of cream, and gentacin eye drops as well. And the last antibiotic that shows activity against some necrotic ulcers in which the all type of microorganisms are usually present, and this metronidazole usually active against all kind of bacteria, but its principal activity is to prevent the respective area from methicillin resistant staphylococcal infections, and it prevent the malodor and the bad odor that is usually present in ulcer decubitus as well. So these are the range of antibiotics that is usually used in routine clinical practice against burn, pressure ulcers, diabetic foot ulcers, and some kind of topical bacterial infections. And it has its activity against that layer of the skin involved. So that's the whole lecture, and thank you so much.